So today is the day of my surgery. I'm in my hotel room. I've had a lovely shower, taken off all my jewellery and packed an overnight bag for the hospital. I will be picked up at 9 in the morning. I will then go through all of my mark-ups for surgery. I will have an IV fitted. I will meet with my surgeon once more and discuss any questions that I have. I'll get into a surgical gown and then be taken into theatre. So my surgery will take place at 1 p.m. I've been fasting from midnight last night, so no food or water today. And I am very much looking forward to my surgery. I cannot wait to share it with you all. So come across to the hospital now and join me for what lies ahead. Hi guys, so I had my surgery today. I am in my post-op recovery before I return to the hotel tomorrow morning. My surgery started at 1 and I was back in my room by 4. So it took around 2.5 hours with then some recovery to be brought back up to my room. Everything is absolutely fine. I'm dressed. I've been for a walk. I do have a catheter, which is the first time that I've ever had this. So I'm not 100% sure how that comes out, but we will see. I'm walking every hour for 5 minutes just to make sure that circulation is moving. I no longer need an IV, so that has been disconnected, which was pain relief and a saline drip. I've had some food, which was lovely, and I've been informed that I have to drink around 2 litres of water. So to everything to be hydrated and moving around. I feel like I haven't had surgery, but I know that I have because I'm in hospital. It's a very quick and easy procedure to have. I was hoping that I could do the anaesthetic challenge, which involves counting down when you're in the operating theatre to be put to sleep. This is something that I've done many times in the past, and some allow me to record it, some don't. This time I asked if they would allow it to be recorded. Unfortunately, they said no, it's best not to. So I remember the last thought going into the operating theatre, and you go through these kind of locked doors where one door opens, lets the bed in, the other door locks, and you do your paperwork and everything. They put a sedative into the vein, which is a kind of white tube that is injected in. It makes you feel quite drowsy and sleepy. And then I remember them pushing me into the operating theatre, but I don't remember what happened next. So it's completely normal to forget the entire experience, which is something that I've completely forgotten. Earlier in the day, I had my bloods taken as I arrived at the hospital, an ECG, which is wires placed on you to measure your heart rate. And then I was, my weight and height was taken, and also my blood pressure throughout. Having Ehlers-Danlos syndrome, I do have naturally lower blood pressure, as well as being very healthy. So this is something that they've just continued to monitor, which is normal for me. We are all individual. This is the first time I have seen a device which is, they said, for training. So this is something that you blow into, and the aim of it is to keep all 3 balls up to the top. So I asked to have the cut-offs from my surgery, as I wanted to visually show how much was removed, how much tissue regrew, and this is so bizarre. So I'm going to put a picture on the screen so you can see this. There are 3 pieces here. 2 I identify as my labia minora because I've seen those before. The third looks like a chicken wing. It's so random and I have no idea what that is. My surgeon did come to see me after my surgery, as well as obviously throughout my surgery, and he did explain what this third cutoff is. However, after surgery you are quite drowsy. I slept all afternoon and your memory loss is completely normal. So I don't remember what he said. So I have this pot of my labia to take home with me, and a really interesting piece of flesh. So I will find out what this is in the morning. The surgical team come round and check on me every hour or so, just to make sure that my blood pressure is okay, my oxygen levels, that my lungs are working fine, and that I am walking. I feel very comfortable. There is no dressing on my surgical site. I'm not wearing underwear, just a baggy pair of trousers, and the stitching and everything takes care of it. So I do have a catheter which will be removed tomorrow. It's just a tube that takes the urine from your bladder so that you're not going to the toilet, to allow that area to recover post-surgery. I believe I'm having this removed tomorrow, and then it's as if I haven't had my surgery. So I will go home to my hotel tomorrow morning. I will then go and have my wisdom teeth removed the following day, so 2 days from now. and I will be a little bit swollen, walking a little bit slow, but everything will be complete. So I've had a wonderful stay so far, and I can't wait to take you back to the hotel with me. Surgery was a great success. Good morning, it's the morning after my surgery. I had the best sleep ever and I feel great. I'm all dressed and ready to head back to my hotel. I've had a meeting with my surgeon this morning. He came to check me over and make sure that everything was fine. So he examined me once more. The catheter was removed, so now no more ties. I'm just waiting for my IV to come out and then I'm able to go to my hotel. I am free to walk, so already after surgery, I'm okay to stand. It's just a case of putting the hips a little wider so that the swelling or edema is not irritated from walking, but being active is really, really good. I've had breakfast, I've got a lovely tea, and I'm looking forward to exploring Istanbul. So I asked my surgeon to explain the parts that were cut off. So I've got notes on my phone so I don't forget this time. The surgery took 3.5 hours and it involved 4 different processes. Originally, I was going to have my moles removed under general anaesthetic, but as this surgery took longer, I'm now having that done separately under local anaesthetic at the clinic in a few days. My first was the labia minora removal, and these are the 2 small pieces in here. I had vaginal tightening, which is this long piece. So if you think of the vagina as a canal, say it's this, a strip was cut all the way along to pinch it in together to make the resting size smaller. So whilst my muscles remain the same and I have the same tightness, the excess tissue from childbirth expanding and retracting is therefore removed. Just like loose skin off of the body. It doesn't do anything in the vagina. It's not necessary. It was just there for childbirth. So having that strip of flesh removed, it was then stitched together in a straight line, and the labia also. I then had the perineum from the bottom up to the vagina stitched as well. So these combined with the TOT tape, the stress incontinence, means that 4 procedures were performed over 3.5 hours. My urine was tested whilst in a catheter to make sure that it was clear and there was no blood in there, and then the catheter was removed and I have been able to pass urine by myself, which is why I'm allowed to leave the hospital. Now I will receive my antibiotics as well as some cream to use to help with any discomfort, as well as to reduce scarring to the area. Some tablets and some creams to use to keep it fresh and healing well. In myself, it doesn't feel like I've had surgery. I feel absolutely fine. There is some swelling and that's all that you really notice. And yesterday, directly after surgery, I felt some warmth there, but certainly no pain. Hi guys, I'm now back at my hotel room. It is 20 to 1 in the afternoon, which is 23 hours and 40 minutes since my surgery. I feel great. I've got changed into a nice summer dress. I've had a rinse down so that any of the iodine from the surgery is washed off, any loose blood. I feel amazing. I don't even feel like I've had surgery. It's just so comfortable. I can go for a nice walk now, explore the shops, have an absolutely lovely rest of the time here. So I will see my surgeon again in a few days' time for him to check me over. The team are also checking in on me every day. Anything that I need, I just drop a message and they come straight away. I have been given my medication now. I have a protein shake for recovery, which I brought from the UK with me. Protein is so key to healing. I am swollen from surgery. If you can see, my bracelet on my wrist, I put my jewellery back on. You have to remove all jewellery for surgery, but the bracelet on my wrist literally is at maximum capacity. My hands look quite puffy and I think my face is quite puffy, which is normal from having anaesthetic. You swell up, but as I walk throughout the day, move around a lot more, my circulation will continue to clear all swelling, and I'll look more and more normal again. But I feel great, I'm not in any pain, and walking is absolutely fine. So my bag of goodies that I have, there is all of the medication written in both Turkish and English to understand, as well as having the medical team on hand to tell me when to take and apply each cream, pain relief and antibiotics. So I've got all of these, which may look like a lot, but it's only for the first few days after having surgery. As I have stitches in my labia and the opening to my vagina, I have to apply an antiseptic cream and moisturiser to ensure that it doesn't dry out or chafe. Sitting down in the taxi in the car back to the hotel was absolutely fine. Because my menorah were sensitive before, I would always kind of sit side saddle and just kind of lift a leg to raise up off of the seat, and I was able to do that also in the taxi back. So I do have swelling, but that will subside over the coming days, and taking car journeys is absolutely fine. So applying the cream to the surface of the wounds just keeps it nice and clean and hydrated and comfortable. I was advised to walk with my hips just slightly further apart so it doesn't rub or cause friction, and I'm going without underwear. You can wear loose underwear with a panty liner to prevent the stitches from catching, but where possible, just wear a long skirt and the breeze will take you where you go. So we are now off out to explore. I'm looking forward to finding some lovely restaurants and gift shops, and just popping on my sunnies and going for a lovely day out. So now we can enjoy Istanbul.